Welcome to The Explainer. You know, when an older family member gets really sick, it can be completely overwhelming. So today, we're going to break down a pretty common but really complex situation to show you how you can be a powerful, smart advocate for them when it matters most.
Okay, let that sink in for a second. It's a pretty startling idea, right? But for an older person, sometimes the very treatments that are supposed to be helping can actually mix together to create a whole new crisis. And that's especially true as we age, and our bodies handle medications differently. So to really get this, we're going to walk through a really common, high-stakes scenario. We've got a 75-year-old patient with COVID-19, and we're going to see what happens when their treatment plan, with the best of intentions, creates a perfect storm of dangerous symptoms. So here's our patient. She's 75, she's tested positive for COVID, and right now, her biggest, most dangerous problem is severe diarrhea. And look, this is way more than just being uncomfortable. It's a fast track to dangerous dehydration. And in the background, there's this other worry, something called silent pneumonia. So the doctors have her on this medication cocktail, and at first glance, it all seems to make sense, right? You've got an antiviral for the COVID, an antibiotic, and an antifungal just in case, and something for stomach issues. But the combined effect of all these drugs, well, that's the mystery we have to unravel. And this is absolutely crucial to understand. For an older person, severe diarrhea is a medical emergency. It can lead to life-threatening dehydration, kidney problems, serious falls, all within a matter of hours. That makes stopping it priority number one, period. And that brings us to a really important concept, a word you need to know, deprescribing. Now, this isn't about refusing treatment. It's about working with the doctors to ask a really smart question. Are all of these drugs truly essential right now, or are some of them actually causing more harm than good? Okay, so let's start our investigation with the antibiotic amoxiclav. Just look at this number. Up to 34%, that's more than a third of people who take this, can get diarrhea from this one drug alone. That is a massive, massive red flag. And here's why that happens. A component in amoxiclav doesn't just fight bacteria, it actually puts the digestive system into overdrive. It literally speeds everything up, pushing things through way too fast. And that's the definition of diarrhea. But wait, there's more. Then you've got Riglin. Its whole job is to accelerate the gut. So while it might have been given for something like nausea, when the patient already has diarrhea, you're basically pouring gasoline on a fire. And we're still not done. Paxlovid is notorious for causing stomach issues. People joke about it online. And the antifungal fluconazole can also add to the problem. So you see, you've got 4 different medications, all potentially contributing to the exact same dangerous side effect. The perfect storm suddenly makes perfect sense. So this leads you to your first and probably most important question for the medical team. It's polite, it's focused on safety, and it shows you get what the real danger is right now. You're not challenging them, you're partnering with them to solve the most immediate threat. Okay, so once you've started the conversation about stopping the dehydration, you can pivot to priority number 2, that risky antibiotic. We need to figure out why it was prescribed in the first place, this idea of a silent pneumonia. The real question is, what kind of pneumonia are we talking about? You know, one of the scariest things about COVID in older patients is something called silent hypoxia. This is where their blood oxygen can drop to really dangerous levels, but they don't feel short of breath. They don't gasp for air. They can be in serious trouble and not even know it, which is why monitoring is so important. Okay, this next part is maybe the most critical distinction you need to understand. COVID-19 causes viral pneumonia. The antibiotic they're giving her, amoxiclav, only works on bacterial pneumonia. They are 2 totally different things. Giving an antibiotic for a virus has 0 benefit, and, as we've just seen, comes with huge risks. And that makes your next question so powerful. You're basically asking for proof. Do we know for sure that she's taking this risky medication for a problem she actually has? A simple chest x-ray can often tell the difference and make sure you're not causing harm for no reason. Alright, so after you've tackled the immediate danger and questioned the risky antibiotic, now you can finally zoom in on the core of the problem, making sure the treatment for the actual virus is the right one. Now, there are a few antiviral options out there, but as you can see, they are definitely not all the same. Paxlovid, which our patient is on, works really well, and this is a huge but,
It can have dangerous, sometimes even toxic interactions with a lot of common drugs that older people take every single day for their heart or for cholesterol. And that is exactly why you have to ask this question. You have to make sure someone has double-checked all of her regular medications against the Paxlovid. And if there's a risk, you need to ask if a different antiviral, one that doesn't have those interactions, might be a safer choice for her. So, let's put this all together into a clear plan. Remember, this is not about arguing with the medical staff. It's about being a clear, collaborative, safety-focused partner. This is how you go from being a worried bystander to a confident and effective advocate. This 4-step framework, think of it as your script. It lays out your concerns perfectly for any doctor or nurse. First, you state the immediate danger. Second, you question the potential causes. Third, you ask for proof of the diagnosis. And fourth, you verify the safety of the main treatment. It's logical, it's respectful, and it's incredibly powerful. And finally, and please, this is the most important thing you'll hear today. You need to know the absolute non-negotiable red flags. These are not "let's wait and see" symptoms. If you see any of these things happening, you call 911 immediately. No hesitation. Know them, watch for them, and act fast. At the end of the day, in any medical crisis involving an older person, this is the North Star. This should be the guiding principle for everyone involved. First, you make the patient safe. You get them stable and hydrated. Then you can figure out the rest of the treatment plan. We've just seen how asking a few smart, focused questions can completely change a patient's course and maybe even prevent a serious complication. It just goes to show you that your voice, when it's guided by a little bit of knowledge, is one of the most essential tools on your loved one's care team.